Welcome back. Zimbabwe striking doctors have called on the World Health Organization to intervene and monitor the country's health crisis. For more on the story, we're now joined via Skype from Harare by the Zimbabwe Hospital Doctors Association spokesperson, Dr. Tapiwa Mungofa. Dr. Mungofa, good evening and thank you for joining us on the Globe.
Evening, Lula. How are you?
I'm very well, thank you, Doctor. Now, just speak to us about the latest with regards to, it's the 8th week now, doctors are not backing down, government is not backing down, and now you've asked for international intervention. What's the latest with regard to the doctor strike?
Thank you. I think what we have now is, we think it's a deadlock because the government is not doing anything. They are not showing any sincerity in the negotiations. We have tried to invite them multiple times, but they are not doing anything. And we now feel that what is now happening in our hospital is what we are calling a silent genocide. And we think that our government is committing a crime against humanity. That's why you saw us now trying to involve the international community and even the World Health Organization to try and say, guys, look, you should do something about this. We have not any reasonable from the government.
Now, talk to us about the impact of the strike on patients in Zimbabwe hospitals. We have heard reports of people being turned away because doctors are obviously not there and the strike continues. What has this done, or the implications of the strike action taking place?
You know, the situation currently is very sad. We are having the most vulnerable, especially the children and the elderly, are not being attended to each and every day. And it's a situation that we are obviously underestimating. As the Zimbabwe Hospital Doctors Association, we have made efforts to try and look at the current mortality rate in the hospitals. But of course, the officials are not releasing any figures. But we feel that a lot of people are dying without anything being done as we speak. And the situation is dire.
Now, an offer of 60% pay rise was given by the government, and this was rejected by the Doctors Association. And amongst the reasons was the fact of the rise of inflation and the cost of living in Zimbabwe. What exactly are you looking for? Working conditions are also one of the major issues that you've put on the table. What do you need government to do with regards to what they bring to the table, and for Zimbabwean doctors to return to government hospitals and start taking care of their patients?
Okay, thanks, Lulu. What we need is very simple. We have highlighted to the government that they should at least review our on-call allowance at the current interbank rate. Because what we have seen is that the price of basic commodities and the price of other in the country are sort of like reflecting the official interbank rate. And we said they should adjust our salaries accordingly. What we have is we were actually receiving a total package of RTGS 2,400. Which was giving us a total of less than $100 if we are to use the parallel market rate. And the offers that we were getting of 60%, we're only taking our salaries to 2,900, which is something that is not different from what we're currently getting. And so what we were asking from the government is a livable wage. It's an amount of money that can allow doctors to go back to work in the meantime while we're waiting for the economy to stabilize.
What is government indicating in terms of what the issues are? Why are they not able to meet doctors' demands at this point in time? What are the reasons?
Of course, the lawyer on our side is blaming the treasury, that the treasury doesn't have enough money to review the salary of only about 1,100 doctors in Zimbabwe. And also the recent sentiments by the minister to say the sanctions are causing the government not to be able to review the doctor's salary. But all those things are things that we don't feel are true in any way.
What makes you believe that government is not being forthcoming with regards to what they have in the coffers to offer doctors in terms of looking at the economic crisis in Zimbabwe currently that the world is witnessing?
Okay, what I believe that the government is not being sincere is the fact that what we are asking for is something that is unreal, is something that is realistic. We are asking for RTGS dollars. We are not asking for foreign currency. We are not asking for US dollars or for rand. We are only asking for just a minor RTGS increase on our salary. In fact, we don't consider it to be an increase, but we are just telling them to honor the continuous bargaining agreement that they signed last year. So what we are asking for is real, and we are asking it from a government which is collecting 2% of taxes on every transactions in the country, a government which recently was published a budget surplus, and a government which is probably spending more on luxurious trips. So what we don't feel like this government is not able to adjust our salary.
Dr. Mungofa, is there a compromise that you'd be able to reach with government going forward?
Of course. We have already told them, keep on telling them that as doctors, we are open for dialogue, we are open for sincere discussions, and that's what we are waiting for. We have not received any communication.
So with regards to the request to the World Health Organization, what are you hoping that the WHO will do with regards to your crisis and your strike action in Zimbabwe?
We are hoping that the World Health Organization will actually intermediate our discussion with the government so that there can be sincerity. But above all, we had actually asked the World Health Organization to try and get the international community to look at the health of Zimbabwe, maybe try and get foreign funding for Zimbabwean doctors, because we don't feel Zimbabwean doctors are a lot, just a few, about 1,000. And we think that something that can be done with international funding. That is our government.
Has there been any reaction from your request, with regards to your request from the WHO so far?
Not yet. We are waiting for this.
Dr. Mungofa, thank you so much for your time. We'll leave it there for now. That is Zimbabwe Hospital Doctors Association, Dr. Tapiwa Mungofa, joining us via Skype.